If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question: what are the advancements in the treatments of diabetes? Answer by Nancy Perez. Here are the advancements in the treatments of diabetes. 1. Brand new beta cells. Type 1 diabetes develops when a person's immune system wipes out insulin-producing beta cells in the pancreas. But it turns out that another type of immature beta cell has been hiding in our pancreases all along, and scientists think it might be possible to use those virgin beta cells to restore the functionality of the pancreas. 2. A preventative vaccine. Finnish researchers are about to embark on the first ever clinical trial for a type 1 diabetes prevention vaccine. While it's not a cure for those who already have the condition, a successful vaccine could potentially prevent thousands of cases each year, as the vaccine targets a virus linked with the development of an autoimmune reaction in the pancreas. 3. A unique transplant. One woman with severe type 1 diabetes has spent a year without insulin injections thanks to an experimental transplant. Doctors implanted insulin-producing cells into a fatty membrane in the stomach cavity, and the success of the operation is paving the way towards more people receiving artificial pancreases. 4. New pancreas tissue. Earlier this year, scientists announced that they reversed type 1 diabetes in mice by giving them a transplant of pancreatic tissue. The tissue was grown using stem cells from non-diabetic mice, and the success of this method suggests it could be a treatment avenue for people. 2. 5. Intensive treatment program for people with type 2 diabetes who have developed insulin resistance. A ticket to diabetes reversal could be an intensive combination of therapies tested by Canadian researchers. The short-term course trial successfully reversed the condition in 40% of the trial participants. 6. Platypus venom. Scientists in Australia have found a new type of the insulin-regulating hormone GLP-1 in a surprising source, the venom of platypuses and echidnas. In humans, the hormone breaks down really quickly, leading some people with type 2 diabetes to develop a dependence on medication. But the GLP-1 produced by these animals is a lot more stable, providing clues for new diabetes treatments. 7. Longer-lasting meds. Researchers have also managed to make GLP-1 last longer by creating special slow-dissolving molecules that carry the hormone. In preclinical animal tests, their new solution lasted more than 2 weeks from one injection. For people managing their type 2 diabetes with daily shots, this could be an exciting development. 8. A symptom-reducing diet. By putting diabetic mice on a special diet, scientists recently managed to reverse symptoms for both types of diabetes in their test subjects. The researchers think that the diet forces the pancreatic cells into a kind of developmental reprogramming. Next up, testing this in people. 9. Broccoli. There's a compound in broccoli called sulforaphane, and a 12-week study on volunteers with type 2 diabetes recently showed that the chemical was really helpful at regulating their blood sugar. More research is needed, but the results are encouraging, and the drug could one day be added to the arsenal of treatment options. Natural treatment has also shown great success in controlling diabetes side by side with all the above-mentioned advancements. In recent years, lots of patients have preferred natural strategies and techniques as sole option to the solution of their diabetic complications. Here you can know more about how natural strategies and technique work to control diabetes. Answer by Stephen Thomas. Up until relatively recently, doctors were on the wrong track with diabetes. Some were still injecting insulin into patients with type 2 diabetes. They now know this is not the best first course of action. The 3 types of diabetes in layman's terms. Recent discoveries mean that diagnosis of type 1 and type 2 are not as clear as once thought. I'm a specialist practitioner in obesity and diabetes. Yes, that's right, type 2 diabetes can be reversed through diet. Absolutely. Firstly, this is what a normal insulin reaction looks like. Insulin is manufactured in the pancreas and secreted when your blood sugar levels rise. Blood sugar needs to be not too high and not too low. Insulin's mechanism to remove sugar from blood is to put it into cells, like your muscles. If there is an excess after blood glucose has gone into cells, it is then put in the liver and further excess becomes fat. What happens with type 2? When insulin is secreted, the body cells have receptors that accept the insulin's key that then open the doors to the cell to let the glucose in. Sadly, in type 2 the receptors become resistant to the insulin key. Therefore not enough energy gets into the cell. The body has a negative feedback system. Once the cells do not get enough energy, a signal is sent back to the pancreas to manufacture even more insulin. This is a vicious cycle. Insulin keeps going up and resistance keeps getting worse. A drug, called metformin, works by making cells receptive again, but it has limitations and eventually other drugs are needed. This is not ideal. So how can we reverse this? Well, quite simply really. The insulin index is similar to the GI system, and by picking foods that cause little insulin response, the type 2 diabetes begins to reverse. This is a snapshot. The lower the number, the lower the insulin response. Sadly, many government guidelines are not beneficial and largely driven by big food and the sugar industry. Therefore, medical doctors are following terrible guidelines and their hands are tied. Thankfully, in the UK, the Diabetes Organization website now recommends a high-fat, low-carb diet. This diet will make the body feel fuller, have less cravings, assist in weight loss and reduce insulin levels, and make the body start to be more and more insulin sensitive. Those that like the science of this can find it in Jocelyn's Diabetes Mellitus, a medical textbook. Or better, in Guyton's Medical Physiology textbook. Coming off refined carbohydrates, bread, pasta, crackers, pastries, sugar and fructose are all carbohydrates, needs to be done slowly and with careful planning. Cutting down on fruit and fruit juice is beneficial, but keep eating vegetables as they are a good source of carbohydrates due to high fiber and vitamins. Other great ways to lower insulin and improve all your bloods and overall health is the inclusion of intermittent fasting. But that's for another post. Hope this helps. Step away from the carbs, the science behind weight loss, the recipes to make it happen. Beautiful color photographs of every breakfast, lunch, dinner, snack and even drinks. https://www.amazon.co.uk/gp/bo76. Answer by Subodh Mathur. I am not a doctor. I am a diabetic. It runs in my family. I have figured out my own way to control it. In 2008, when I was 57 years old, I was diagnosed with diabetes. My readings were sky high. Fasting sugar was 200. Few. And my A1C was around 9.8. Walking wounded. My wife and I decided to try to control it by a three-pronged approach: medicine, diet, and exercise, with associated weight loss. I met an excellent specialist, who explained diabetes to me professionally and clearly. Of course, I had already everything available on the internet. I asked him to prescribe the starter dose, what they prescribe for people with fairly low readings, or even pre-diabetes. I said I will handle the rest. He said, I don't believe you, but I trust your wife, who is sitting next to you. The starter dose was 2 tablets a day of 500 mg metformin, glucophage. Today, 9 years later, I am still at this level. In between, I had gone down to 1 tablet, and may be able to move down to 1.5 tablets per day. Diet. I experimented quite a bit with various foods, keeping track of my sugar. The conclusion is that for me the amount and type of carbs I eat is critical. Pasta, pizza, French fries, samosas, bananas, my sugar goes sky high. If I eat a low-carb, low-glycemic index meal, sugar is quite reasonable. Exercise. I devised a method of lowering my sugar quickly. This is through high-intensity interval training exercise. I call it huff and puff exercise. Exercise for 7 minutes. Within this time, have 3 bursts of 2030 seconds each in which you huff and puff. Work hard. The rest of the time, just low level. For the technically inclined, in the huff and puff, I hit 8 or higher meds, rest of the time 5 meds. This 7-minute exercise usually drops my sugar reading in the range of 1,530 points. So, if I am at 150, it will drop to 135 or less. I do this at home, on a treadmill, or even just walking fast up my staircase. In contrast, if I walk normally, it takes me 30 minutes to drop 20-25 points. Some days, I cannot control my eating. So, my sugar may touch 200 at 2 hours after eating. Now, I know I need 3 sessions of my huff and puff. I will be at 120 or so at the end. I am lucky in some ways. I sleep well. Exercise at night does not keep me awake. I sometimes even drink normal black tea after late night exercise, and then go to sleep. Make it personal. You need to figure it out for yourself. You need to experiment with different foods to see what makes your sugar go high, and which foods don't. You need to find for yourself what type of exercise you can do, and how many points of sugar drop with different exercises. It's especially important you figure out your evening meal, Never go to sleep with a high sugar level. For me, anything over 150 at night is not acceptable. I will try my best to do some exercise. It will mean that you need to check your sugar 34 times a day, at least initially. My docs have no problem with this. And, I hardly ever check my sugar when I wake up. That reading is not actionable. I cannot do anything with it because I cannot exercise until I have had breakfast. So, I take my readings at actionable times when I can do some form of exercise to reduce them. I have worked out different forms of exercise at different times. Even when you're with friends for dinner, you can suggest a 1,520-minute walk, and sometimes people agree. Sometimes not. Then you come home and walk. I hope this perspective from an informed diabetic helps you. I did discuss it with my doc, and he said, "You are a model patient." But, to me, it's just common sense.